Good morning, everyone. We're probably going to give it a minute or so for others to join us, but we'll get started shortly. So thank you all for waiting. All right, so good morning, everyone, and thanks for joining us today. My name is Avery Davis from the Syracuse University Environmental Finance Center, and I will be your host for today. So on behalf of the Syracuse University Falk College Department of Public Health, the New York Water Environment Association, the New York State Water Resources Institute, and the Syracuse University Environmental Finance Center, welcome to our webinar today on an introduction to the New York State Wastewater Surveillance Network. In this one-hour webinar, experts from the Falk College Department of Public Health at Syracuse University and the SUNY College of Environmental Science and Forestry will introduce the New York State Wastewater-based Epidemiology Network, which provides real-time monitoring of wastewater for coronavirus RNA. We'll begin today with presentations from two of our experts and we'll conclude with a facilitated discussion with your questions as time allows. So first, for a little bit about the Environmental Finance Center. Our team enhances the managerial and financial capacity of regional and local governments, nonprofit organizations, and local residents to improve environmental infrastructure, services, and quality of life. Our partnership with our co-host for this webinar series is supported under a grant by the Rural Utilities Service housed in the United States Department of Agriculture. Thank you to our co-hosting partners for this webinar today. The New York State Water Resources Institute's mission is to advance water resource management and address critical water resource problems in New York State and the nation through research, education, and outreach. To learn more about the New York State WRI, please use the contact information shown and visit their website. The New York Water Environment Association, or NYWEA, serves the best interest of the public by promoting sustainable clean water management through science, education, and training. If you have any questions about NYWEA, please use the contact information shown and visit their website at nywea.org. And thank you to our partners. During the webinar tonight, everyone will be kept on mute to ensure audio quality. If you have any questions or comments, please type them into the GoToWebinar question dialog box anytime throughout the session. We will be holding all questions for a facilitated discussion at the end of the panel. We will also be posting the presentations as well as a video recording on the Syracuse University Environmental Finance Center's website. You will be receiving a follow-up email that includes a link to all of these materials. Also, in your control panel and GoToWebinar, under the Handouts tab, we've uploaded 3 PDFs for your viewing. These include the presentation slides from today, a document with resources related to today's discussion, as well as today's agenda. So those are available for your view and download if you wish to view them. Please note that this webinar has not been submitted for approval for continuing education credit, but we are happy to provide certificates for your personal record. To receive a certificate of attendance, we ask that you attend for the entire duration of the webinar and that you would register and attend using your real name and unique email address. All participants who meet the above criteria are eligible to receive a certificate, and any questions about certificates can be directed to SUEFC at adavis02@syr.edu. or see our website at efc.syr.edu. And on that note, we can begin today's discussion. So on the screen, I have a simple agenda that lays out how this webinar is going to go today. So we have 3 presenters and panelists with us. I would like to welcome Dr. David A. Larsen, an associate professor and Master's of Public Health Director at the Falk College Department of Public Health at Syracuse University. I would also like to welcome Dr. Mary B. Collins, an associate professor at the Department of Environmental Studies at the SUNY College of Environmental Science and Forestry. Also joining us on our panel today is Dr. Dustin T. Hill, a postdoctoral researcher at the Falk College Department of Public Health at Syracuse University. And on that note, we can get started with an introduction to the New York State Wastewater Surveillance Network. So David, welcome, and I'm gonna make you a presenter and we can get started.
All right, thanks so much, Avery. It's a pleasure to be with you this morning, talk a little bit about some of the work that our teams over here have been involved in since March of 2020, trying to build this for the state of New York. And the work represents a lot of effort from a lot of different folks, a large team of folks working on this. And so we'll talk about the State Wastewater Surveillance Network for COVID-19. First, I'm going to talk a little bit about why we would do such a thing or have such a system, and then how it might be applied, and then what the future of it might look like. And so when we think about COVID-19, the event of interest, like the event that is concerning for everyone, is this transmission event, right? So when COVID passes from one person to another, that's the spread of the virus, and that's actually unobservable. So we don't actually see that ever. We can't see it with even microscopes. Would be impossible to catch that. Maybe somebody could design something to see it, but it's an unobservable phenomenon, and so we rely on indicators. And these indicators give us clues about what transmission is like in a community, and that then can inform us what the risk to the population is and everything. And the three primary indicators we've used throughout the pandemic and even before the pandemic are cases and test positivity, hospitalizations, and deaths. Now, each of these three indicators are limited. You know, cases and test positivity, those depend upon symptoms and testing access and reporting. And we can think about how this changes over time from the very early days of the pandemic when testing was not available to now we have at-home tests being mailed out to every household that signs up. Hospitalizations are a great indicator of transmission, but they also lag days or weeks behind transmission. And so once hospitalizations are surging, there's quite a lot of transmission in a community, and there's a lot of risk to vulnerable individuals. And the same thing for deaths as well. Hospitalizations and deaths, they could be characterized as the tip of the iceberg, that if we're relying on these two indicators for understanding COVID risk, there's a lot more transmission beneath the surface than what these two indicators show. Now, wastewater is a little bit different. Now, wastewater surveillance has been broadly used for 50 years or so now, and especially in the 1990s to fight polio, not here in this country, but in other countries. And in the context of polio, you know, polio is a fecal oral transmitted virus. So people shed virus in their feces, it gets onto their hands somehow, and then it gets into the mouths of children somehow. And when you consider polio, those indicators of hospitalizations and deaths are similarly a tip of the iceberg situation. We most closely associate paralysis with polio virus, but paralysis only occurs in about 0.5% of cases. So 1 out of every 200 cases leads to a paralysis case. And so you can understand that you could have a surge in transmission, a surge of cases without seeing paralysis, and then all of a sudden these paralysis cases pop up. And by looking at the wastewater, you know, scientists and public health officials, they found what's called a silent outbreak of polio, where they didn't see any paralysis, but they saw a lot of polio virus in the wastewater, and they're able to rush in and do mop-up vaccinations in order to prevent polio-derived paralysis. And it's pretty simple approach. You take a sample of sewage. Here's an open sewer here, so you just take a sample of this. There's a process to filter it and to concentrate the nucleic acids in that sewage. And then there's a test in the laboratory, a PCR test, and it's very similar to the diagnostic PCR that we have for nasal or saliva for COVID. And then you can deploy interventions, make public health advisories, and try to prevent severe disease moving forward. And so the idea here is wastewater, could we add that as an indicator to what we already have regarding COVID-19? In some ways it may be superior. And so can it be a real-time unbiased community level indicator in ways that cases, test positivity or not, and then much earlier than hospitalizations and deaths? If we look at the testing access in context in New York State, this is all the tests reported to New York State from their public available database from the beginning of 2020 through today. I think maybe yesterday was the last day it was updated, or 2 days ago, right? And you see that the beginning of the pandemic, you know, it was fine. Early 2020 started fantastic, you know, nice New Year's Eve parties, great visions ahead. And by March, you know, the New York State schools had closed across the state. And we look at how many diagnostic tests were being conducted in the state is very minimal compared to what we're doing today. And this long lead up time, or this long scale up time to diagnostic test availability is pretty standard. That's based on logistics, it's based on human behavior, it's based on testing capacity and availability. It takes time, right? And so in the early days of this pandemic, we didn't have a good understanding of where transmission was and where it was not. And so it forced broad statewide shutdowns. Now, we did understand that there was hospitalization surges. We could see what was happening in New York City, and it was an appropriate response, in my opinion, given what we knew at the time. But how could it have been slightly different, or would it have been different if we could have scaled wastewater surveillance at the time? And we didn't have the same scientific understanding then that we have now. But could we be more prepared for the future? This map here on the right shows every municipal treatment plant, wastewater treatment plant across New York State. There's about 600 of them. And because everybody poops, these treatment plants become representative. The material flowing through these treatment plants is representative of whatever's in our bodies, including viruses and pathogens. And so the sample from this treatment plant is actually representative of all of the individuals contributing to that. And we can get community level estimates of wastewater, right, at a representative level. It's low cost and it's convenient. How quickly could we scale up 600 tests, right, 600 treatment plants tested in a new pandemic scenario or situation? And that's what we're trying to build here. I think about wastewater surveillance as one of our pillars of our health security, that without it, we become vulnerable to an emerging infectious disease, to a potential new variant that causes severe disease, and we become vulnerable to requiring broad, geographically universal shutdowns to try to prevent the spread of these diseases. And so our infectious disease surveillance here, right, is standing up with this wastewater surveillance as one of the pillars. Now I'm going to get a little nerdy here and go into some equations. I got into wastewater surveillance for COVID-19 because my kid's school was shut down, and any parent during the pandemic, in my experience during the pandemic, remote learning is hell, and my children fight, and there's conflict in the home and boredom, and it's just hard. It's been rough, and we've had it better than most through this pandemic. And so thinking through how can we keep our societies as open as possible in the midst of the risk of pandemic threats or emerging infectious diseases, and we have to prove that our communities are safe. And we can do that using wastewater in a way that we can't do that using test data, case data, or test positivity data. And so if we look at this wastewater sample that's representative of the entire community, and we don't detect whatever we're looking for in that sample, whether it's COVID-19, whether it's polio, or whether it's the next emerging infectious disease, then there's one of two possibilities. Either that community is safe, what we call freedom from disease, or our wastewater surveillance missed the pathogen. Now, if we estimate the sensitivity of our wastewater surveillance network, then we can calculate a probability that, yeah, that community is safe. And then the number of times that we consecutively don't detect that increases the confidence that, yes, that community is free from these diseases. And that's what we're hoping to do over the summer. And so we're establishing the statewide network that I'll go into a little bit. And over the summer, we'll start estimating that the communities are free from community spread of COVID-19. And it's based on this analysis here in this figure. And I'll talk you through this a little bit. This is the most technical we'll get on the epidemiology side. Whenever we pull a wastewater sample, we have three potential levels of coronavirus. There's levels of not detected over here, and then there's levels where we detect it, but it's at very low levels. So there's some coronavirus RNA in that wastewater, but it's too low to accurately quantify how much. And then we get quantifiable levels. Now, on the x-axis over here is we have 7-day COVID-19 cases on this figure, and then this figure is test positivity. So when we don't detect it, the majority of our community level transmission indicators show that risk is very low. This is called a box plot. And so this dark thick line is the median or the average. And then this line here, this horizontal line, is the range. It extends to the left up here. That's the range, and then these dots here are outliers. And each of these points is a wastewater sample with the size representative of how many people were tested at that time. And so on average, when we don't detect COVID-19 in the wastewater, we see that our cases are low, according to the CDC classification, that the past 7 days, there's been 0 to 9 per 100,000, that the risk of COVID is low in that community, test positivity below 5%. And about 40% of the time, we see there's no COVID cases detected. So that's if we don't detect it here. Once we start getting below limits of quantification, we're still really confident that it's just a moderate risk. Then when we get to limits where we get quantifiable levels or high levels of coronavirus, then we see this very high risk. And we're really looking forward to the decline of this surge, not only because it'll make our lives better, but also because we'll start communicating which communities we're seeing this very low to moderate levels of risk based on the wastewater data. That's one application of this, that we can confirm that communities are safe. The other application of this is to give an early indication that communities are not safe, that communities are at risk of transmission. And this is from some of our partners in Oneonta, where they've been sampling since the SUNY Oneonta big outbreak in the fall of 2020 at super high levels, and they've come down, and we see the surge in 2021 and now going through this current surge in 2022. And we can immediately see, like, our current 2022 surge is higher than our 21 surge based on the wastewater. We know that based on cases, test positivity. As we go forward in time in the pandemic, our testing behavior will change. As people get vaccinated, they have fewer symptoms also, that changes. And so this is going to be an unbiased estimate across time to see how bad, how risky is coronavirus right now in the community relative to last year, the year before. And these trends, they gain strength over time. And so some of the communities that are just coming in to the wastewater surveillance network, they won't be nearly as strong as Oneonta, because Oneonta's been doing it for almost 2 years. But they do gain strength over time, and we do have long-term commitments. So a little bit of history. My team, we started in March of 2020 when there were some Dutch scientists that they actually tweeted out that they had found coronavirus RNA in the wastewater, and based on my training in infectious disease surveillance, I knew that that was a game changer for many of the challenges that our state and our communities faced regarding COVID-19. In the fall of 2020, we started the state pilot in 4 different counties: Onondaga, Erie, Albany, and Newburgh. We learned a lot. We learned a lot from that pilot. And then now we're moving into the implementation. With the funding levels that we have, our goal is to establish at least one treatment plant in every county. This is a visual representation of what that might look like. These light gray circles here are all the municipal treatment plants across the state, right? And then the orange circles are which treatment plants we're enrolling, and we're actually starting to ship kits, sampling kits out to them now. And then there's at the same time that we're pushing this with the state, the CDC is pushing a national wastewater surveillance network, and so our data go up through that CDC national wastewater surveillance network, and then they've contracted with some labs to take on some cities like New York City, some of the larger urban centers, and some of those large urban centers will participate in both. But the whole focus here is to build that health security. Here's the national wastewater surveillance system. The website's here. Ohio's one of the early pilots for the CDC because that's where the Environmental Protection Agency is and has history there, and this is their dashboard. But the CDC dashboard, I'm not sure if it's public yet, but it is planned to become public here shortly. Now there's a lot of basic work and infrastructure that we've built over the last few months to enable this. This map is a map of sewer sheds across New York State. So the orange is the outline, and then the blue, the fill, is what communities are on sewer and which ones are not. And we find that about 75% of the New York State population is on sewer. Rural areas with septic or less. For the sensitivity of a surveillance network, we're modeling how that affects our ability to pick up a pathogen and model that freedom from disease. But we don't expect a virus or a pathogen to stay within unsewered communities. So it will jump to the sewer if it arrives in like a septic system, and it will eventually jump to this, or quickly jump to the sewer if it's a threat, and we'll pick it up. And so we're talking delays in days if based on septic rather than sewer in terms of early indication. And then from the state, we expect to cover about 70% of the non-New York City population in the state with this implementation we're doing now. Now this indicator, wastewater surveillance, it doesn't replace any of the information we already have for the pandemic. It's supposed to complement it. And we've seen in the data that the strongest correlation in what we see with the wastewater, it's most strongly correlates with active cases and test positivity. So these data are from the city of Cortland in Cortland County with the, so I gotta move this thing, all right. And so with the red here is the active cases. And so the number of active cases, they just last about 10 days, right, from an incident case. And then the blue here is the wastewater. And so the top graph, sorry, it's new cases daily. How many new cases daily? You see the surge, wastewater tracks it right along with a little bit of early indication. And then the correlation is about a 0.4 for the wastewater levels in the cases, the new cases, then about a 0.656 or 55 for active cases. And across the state, we see about a 3 to 5 day lead time between the date of the test for wastewater compared to clinical surveillance. And so that'll be dependent on testing availability, also testing behavior as we begin to embrace more home tests and whatnot. So in the news, right? Boston's been monitoring wastewater since the beginning of the pandemic in March, and they've seen, put out advisories that their transmission has soared. So this was from December 8th of 2020. Right, this is the first surge or the first holiday surge, 2020, 2021. The 21-22 data are even greater surges, but thankfully it's peaked in Boston, the wastewater levels, and so they're starting to come down now. And here's an example from last year in one of our communities. As on the left, you see the incident cases peaking just before New Year's Eve, and then you have the test positivity the same, peaking before New Year's Eve. And then our wastewater does exact the same, peaks right before New Year's Eve and then comes down. And for me, what this suggests is I anticipate a holiday surge next year, but I also anticipate that testing behavior will be very different. Policy landscape will be quite different from this year. And so we'll be able to gauge risk of transmission, what's truly happening with using wastewater, because the other indicators they're not as time constant because of the policy and behavioral changes to the surveillance, to testing behavior. All right. We're building capacity for a rapid response genetic sequencing. And so we had, the Alpha, Delta, Omicron variants have all arisen, and I would suspect that there will be another variant sometime. And so using wastewater, because it is that geographically representative sample, it's the quickest way to get understanding of where a variant might be and where it's not. And so this is an example of how we might detect it at the county level. Relative to incidence, we can get confidence that a variant is there or not. And this is not variant prevalence at all. This is the confidence that the variant would be here if it was not found in the wastewater. One of the use cases that we're testing is, can we actually increase vaccine uptake with wastewater surveillance? And so when we look at the vaccine hesitancy among parents and among folks that are hesitant to get it, there's three primary factors that drive vaccine behavior. There's the perceived risk, if they perceive that COVID is a risk to themselves or their children. There's the institutional trust, whether they trust the vaccine safety profile and the public health officials. And then there's the convenience, where are they able to get a vaccine or not? And we anticipate the wastewater surveillance network to help all three of these things. The perceived risks, we will transparently and publicly let folks know when there's an increasing COVID-19 transmission based on wastewater data, to provide those prompts and those cues that it might be time to change some of the behaviors, whether that's masking, vaccine, or social distancing. Then we'll be transparent and shout it from the rooftops when we don't see it. If we don't see coronavirus in the wastewater, again, that should change people's behaviors. If there's not coronavirus in a community, why not visit, and why not get together? We hope that can build institutional trust in the public health systems in the state, and increase vaccine acceptance, and increase adherence to advisories as they arise. And then for the local health departments, and the state health department, we can guide public health resources and identify quickly which areas have the highest risk of COVID or other infectious diseases. Now we're just starting to implement this system, but cost has always been on our minds. And what is the cost of a wastewater surveillance program? And I think about that question, and I think about my homeowner's insurance. What's the cost of my homeowner's insurance? And then what's the cost of not having it? And so when we look at proportional costs of what we estimated, I think this is from last year, and so these numbers are higher than what they would be now. But the proportional cost compared to sales tax lost during the first year of the pandemic it would only cost about 3% of the lost revenue from that. And then the CARES Act, less than 1/2 of 1% of what the CARES Act provided. And so we're building up to this full comprehensive wastewater surveillance network, and we hope to be there over the next couple of years, and then maintain that, similar to ways we maintain our insurance and whatnot. Now, the future of wastewater surveillance for public health, wastewater surveillance is a system, right? And the system can be applied and adapted to many public health issues. One of the ones we're keen on is the monitoring of opioid use and supporting the public health response to the opioid epidemic. We can monitor trends of use in communities over time to understand where it's increasing, where it's decreasing, where might we target more public health resources, where do we need support, and different things for those with opioid addictions. Europe for the last 10 years, has done illicit drug use monitoring in the wastewater. And so we're looking at their model and thinking how might we adapt it for New York State. Beyond COVID-19, multiple other infectious diseases can be surveilled in wastewater. Our teams First ones that we're looking at are RSV, respiratory syncytial virus, which is a very dangerous virus in infants, and then influenza. And both of these are seasonal. And so we can, with the seasonal viruses, we can give public health advisories when it's high, when it's low, to help guide public health response and public behavior. And then the next pandemic threat. And this figure here, these lists of all these viruses of pathogens, or lists of families of viruses, are all these different families of viruses that can be found in coronavirus, and then some of the different infectious diseases of international concern and greatest burden diseases. We can find a lot in wastewater, whether it's fecal oral transmitted or not. That was a huge paradigm shift in my own mind as an epidemiologist, where prior to the pandemic, I only thought about wastewater surveillance for things like polio and norovirus, and other viruses that are diarrheal diseases or fecal oral transmitted. Now, myself and other epidemiologists are starting to think of wastewater as representative of community, not only for viruses that are transmitted through wastewater, but also for viruses that would be inactivated in wastewater. And so things like malaria, that's a mosquito-borne disease. We're not at risk here in New York State, but it's likely useful for malaria, dengue, Zika, mosquito-borne diseases. Coronavirus is a respiratory transmitted disease, and so it's useful for that. So I would anticipate, if I had to guess, the next emerging pathogen that causes public health concern, I would guess that it could be surveilled in wastewater, and so this system will be ready for that. And so that's what we're building. If you have any questions, let me know. Feel free to reach out. Mary's going to talk about the dashboard now, and walk you through the dashboard and the website. And so I'll hand it off to Mary.
Hi, can everyone hear me and see my slides, hopefully?
Yep, looking good, Mary.
Great. Well, again, I echo what Dave said in terms of thanks for having us today. And what I'm going to spend time doing is talking about our vision for communicating some of these findings beyond the scholarly literature via using this New York State Wastewater Surveillance Network dashboard. And before I get going, Dustin Hill's on the call today too, and Dustin and I have worked together for a long time, and he has really been in the weeds with this. He's been doing this just as much as I have, if not more. And so even though you hear my voice today, he's done a ton of work to make this dashboard a reality. So as Dave said, the New York State Wastewater Surveillance Network began in early March 2020. And we have participating counties and wastewater treatment plants that provide wastewater samples on a weekly or a semi-weekly basis. So, up to 2 or 3 times per week. So those data, we use them to we show trends and maps that we create to show how this surveillance might help guide a response to this pandemic. And we're also interested in communicating to public health officials about actions that they might take, how you might protect communities when there are increases in transmission, or relax when there are declines in transmission or low detection. Of course, we're very interested in engaging with municipalities and local health departments, and this is one of our first steps in trying to do this via this public dashboard. So let's talk a little bit about what you see here. So when you get to our dashboard, you see some supporting information. Up here, you can click on some resources which provide, this is a static shot, but I will do a live demo in a few minutes. We have some resources, some definitions, some information about who to contact if you have a question, some FAQ style communication, and then also just some basic information about where are we at? How many counties are currently reporting? How many wastewater treatment plants are currently participating? What population is upstream of our samples? And then Also a little bit just about like, when was this last updated? When was the most recent sample included? And again, this is just to get your bearings. This is the main welcome page. And then from here, you can navigate to wastewater and case data by county. So what happens after this initial phase or this initial splash page is you can show a 2-week trend in both wastewater and cases by clicking on the map. So the first thing you would do is click on a county that you want to learn more about and choose a wastewater trend, either our intensity model or a gene copy load. And I'm going to go through gene copies first, but I'll get to the wastewater intensity model in a few minutes. And then a comparison to the case data, of which you've seen some of it already from Dave's presentation. So the first thing that I'm going to do here is I'm going to decide that I want to look at Orange County. And what I did was I zoomed the map in a little bit just to be able to click on the county more effectively. So once I click on the county, it zooms in and it displays, you can display various base maps like the wastewater treatment facility points, the catchment zones, which are these sort of light yellow zones. You can pick different base maps and show the legend or toggle it off. And sometimes we do that just so that in case it's covering something. But each of these points is clickable and you can zoom down in to see the results from that specific spot in comparison to relevant case data. So from here, I decided that I was going to click on the Middleton collection point, which is a wastewater treatment plant. And what I'm interested in doing here, or the first thing I'm going to show, is I'm going to compare gene copies to various case data values. So comparing these trends in wastewater surveillance to observed case data is useful really in terms of confirming the trends that you see in the clinical case data, and it can provide some additional insights into community transmission. But so the first thing I did is I click on gene copies, and that changes this top graph to show the gene copy trend over time. And then right below this top graph is the case data graph. So right now, what I'm doing is I've clicked on the new case data radio button, and what that does is it populates the new case loads for the relevant geography that you've selected. So you can also compare this gene copy load to other case data values. And as Dave said, active and test positivity possibly has a better, it lines up a little bit better with our wastewater data. So for example, you can see by clicking on active cases, it changes the graph at the bottom here to active cases within the geography that you've picked. So I'm in Orange County. And again, you can, even at looking back at the new cases, you can see just by, looking at the two graphs using some sort of eyeball test, of course, you can see how the gene copies really does line up with the new cases. It lines up with the active cases. And you can also compare the gene copies to test positivity in the geography as well. So that's this third radio button over here. And so, this is the general flow of using this dashboard. It's, you have some information at the main welcome page related to the project. You have some resources that I can click on when we get there. And then looking at a comparison between the wastewater trend and the case data is how we have it set up at the moment. What Dave also talked about is the intensity model that we've been working on. So wastewater data in this case are normalized for fluctuations in human fecal content contributions. So how we do this is we use the bacteria crassphage which is measured along with every single sample. And what's great about it, and what I've learned through working with this project, is it's a ubiquitous gut phage. So it's one way to kind of have an estimate of the total number of people upstream contributing to the wastewater flow. So we use this ratio to estimate values in the wastewater. So higher values indicate higher viral loads and potentially higher transmission in the community that the sample was taken from, or the upstream community that the sample was taken from. And really, you can look at these trends over time to make comparisons over time. One thing that I want to point out right off the bat is that when you compare the model to the test positivity data, as I'm showing here, you can see that the model is dampened a little bit in comparison to the test positivity rate comparison. So in this case, what we're using a log adjusted value for this intensity metric. And what that tends to do is it reduces the influence of really large spikes or declines in detection. And this is important because, there are lots of things that can cause these types of spikes. So this accounts for things like high intensity rain events or other things that could make detection more difficult from one time point to another. But basically, single samples will show a snapshot in time for the level of coronavirus detected in wastewater. And several data points in a row will give you some idea related to an indicator of viral trends within the upstream community. Again, I think it's still really useful to be able to compare these trends to observed case data, and it's useful just for doing some sort of confirmation as you look at these data. I'll also reiterate that, as Dave said, one of the most exciting aspects of our modeling efforts, although we'll continue to innovate them, is that we really look at these modeling efforts as an unbiased estimate, not dependent on things like symptoms or testing trends or even politics, if you will. So it's really something that is useful to look at over time. Lastly, or the last slide that I have before I click on the, lastly, I have, how do we get back to the original map? Well, you click on this state map view, and that takes you back to the beginning where you can pick a new county or start over. So that's how you kind of revert back. The next thing I wanted to show you is I want to click on, I have a link to the dashboard here, which I think we're going to share in a little bit. And I want to go to, I want to go back to the app and see if I can show you some of this usability or these functions in real time. So this is the live dashboard. It's the same. I screenshotted everything last night, so I haven't updated it yet today. And you can see some of our counties here. What I'm going to do is I'm going to stick with our intensity model here for the wastewater trend, and I'm going to change to test positivity down here in the case data. And I'm interested in looking at Jefferson County. So I'm going to click on Jefferson. What it does is it zooms in. We have 2 wastewater sampling sites going on. And you can see the geometries. I can show you some zip codes if you're interested. I can toggle on and off the legend, change the base map, show the points, not show the points. And then you can scroll down and take a look at the trends over time. And one of the ways that I've been using this, and when I talk to people who are using it, you know, really kind of playing around, toggling between things, looking at, you know, active cases, new cases, and kind of just giving it a look and then asking a question. So I can also click on the gene copies value and see this is just the trend in values of the SARS-CoV-2 detected in wastewater, you know, the actual copies of genome copies that are counted with each sample. So, you know, big spike here, and we are used to seeing you know, a correlation between these types of spikes and the clinical data. And then again, you can click on the state map view, and that'll take you back to the big New York State map, which you can, you know, zoom into or zoom out of, depending on, you know, where you're at with what you're doing. And I said I would click on a few of these things too. So you can click on the information tab, which gives you some information about our project, how you can, we have some links for you, and whatnot. And let me reload this for a sec. And then we have some resources and toolkits, which are, you know, have some FAQs and some things you might want to do. But we're continuing to innovate each day, and we really try and launch new data as it comes in. So we're trying to make this as real time as possible. Okay, so let me figure out where I'm at here. And oh, sorry, I just saw this question. Someone's asking, what does gene copy mean? It's counts of genome counts per sample. Okay, so maybe I should stop sharing the screen and we could move to the Q&A portion.
Sounds good.
Yeah. Oh, sorry, Mary, go ahead.
No, I think that's great. Avery, do you want to, we've got some questions coming in, but we've also got a couple of poll questions for the audience themselves. So I'll turn it over to you, Avery.
All right, so I'm launching the first poll. And this one is asking after this initial view of the wastewater surveillance dashboard, my first thoughts are, we'll leave it up for about a minute, but the options are, it looks useful and you would use it. You might need more guidance on how to use it. It's not useful to you personally. It's just what New York State water or wastewater treatment utilities need, or it needs revising before you would use it. So leave it up for a few more seconds. Okay, I'm going to close this poll in 3, 2, 1. And it looks like the results are 80% said the dashboard looks useful and they would use it. It looks like 13% answered they would need more guidance, 4% it's not useful to them, and 23% this is just what water treatment utilities need. And then we also have one more poll just on how you might use the dashboard in the future. So after this initial view of the wastewater surveillance dashboard, I anticipate using the dashboard. There's frequently, occasionally, seldom, never, or not applicable to you. You're just here to learn. Looks like about 60% have voted, so we'll leave it up for a few more seconds and then we can transition to the Q&A. Okay, we'll close the poll in 3, 2, 1. And it looks like 45% answered they would use the dashboard occasionally. 33% are just here to learn. 12% said they'd use it frequently, and 10% answered seldom. So great, we're happy to see your initial thoughts, that quite a few of you intend on using it either frequently or at some point in the future. So I'll hide those results, and then Meredith will lead our Q&A with our presenters.
Yeah, great. Thank you so much, Avery, and thanks to everybody for participating in the polls. We appreciate it. So thanks for hopping on camera, folks. We know David doesn't have a camera access today, but we've got Mary and Dustin, and I'm Meredith Perot with the Syracuse University Environmental Finance Center, and I'm looking at my screen and a lot of good questions are coming in, so thank you. Keep sending them on in. And Mary, this one is a clarification question, kind of builds on the what does gene copy mean? There was a person asking can you explain the difference between gene copies and the SARS-2 intensity related to the dashboard?
Sure, I can, and feel free, Dave or Dustin, to jump in. The gene copies is the, absolute number of gene copies, genome copies that we see in a sample. So it is, a raw number, right? The model is a guess at upstream transmission trend, over time. So the model accounts for things upstream in ways that the plain genome copies do not. So for example, there are situations upstream like what's the total population, or are there specific institutions upstream that would be interesting to account for? Are there environmental conditions that we want to account for, like big rain events or other types of things that would impact the flow or the, what we see going on at the collection sites? And we are innovating the model all the time. And one of the other things that we like about the model so much is it's not related to testing, it's not related to symptoms, it's not related to politics. It's really supposed to be a way to compare what's going on over time in communities. And hopefully that helps.
Yeah, great. Thank you, Mary. That's terrific. And I'll just keep throwing questions at you all, but Mary, Dave, and Dustin, feel free to go ahead and answer. Here's a good one. Is it unlikely that a new variant would be different enough that its RNA would avoid detection in wastewater sampling?
That's a really good question. So far, we haven't seen that with any of the variants that have arisen, and so the ability to pick up the RNA in wastewater is going to be a function of how much wastewater how much RNA makes it into the system through either fecal, saliva, or other types of shedding, and then what the primers are, what the makeup of that virus is. And so, SARS-CoV-2 appears to be pretty robust in wastewater. It's not infectious in wastewater, but it does appear to be able to be found there. SARS-1 from 2003, that was documented to be able to be found in wastewater. And so we've got no crystal ball for the future, but past experience suggests that the next variant will be detected in wastewater as well.
Okay, great. Thanks, Dave. That's helpful. Mary, this one, or actually Dustin as well. Dustin, you were working on the app. Here's a question. Does the app have a place that tells specifically where the data comes from for new and active cases and quote tests? So looking for where, if there's a place where it tells where the data comes from.
Yeah, that's a great question. So there are two places on the dashboard where individuals can learn about the sources of data. One is on the information tab that Mary showed, and under the data section, we do link out to all the external data sources, including the New York State reported case data. So that's where the new case data come from. And then for active cases and the test positivity, we calculate a 7-day rolling average. And that information, so each of the figures, there's a button beneath it that says display the description of this figure, and you can toggle that on, and it gives you, a few sentences or a paragraph describing each of the figures, and that includes our methods in there for case data calculation.
Great, thank you. That's awesome. Amanda is asking, how often are wastewater treatment plants submitting sample data?
So that one varies by treatment plant. Some are submitting multiple times per week. For the state-funded program, we're trying to get one treatment plant in every county to submit once per week. And that's a function of funding levels. We're looking to expand that later this year to be twice weekly. Twice weekly appears to be kind of a sweet spot in terms of sensitivity to surges as well as cost. And so that's where we're at. The CDC program is twice weekly as well. The national 500 sites is twice weekly also.
Okay, great, thanks, Dave. Patty is asking, how do we get instructions for how to sample and send? So it looks like an interest in participating. So how to get instructions, maybe how to get started.
That's great. So we'd love to have you join. You can reach directly out to me at my email address, and we'll see which community you come from and determine if that's already included in the state program or if you'll be joining through some other funding mechanism. Counties have joined in using a variety of ways. Some have found public-private partnerships, so industry have paid for wastewater testing. Our commercial partners here in the state charge about $225 per sample, which is the lowest cost of anybody nationally that I've seen. And so some counties have done that. Other counties, they've used their enhanced detection grants for COVID response to do that. And so these are allowable costs. And then with the state, we only supplement, we don't duplicate what the counties are doing. And so we can help coordinate that and put you in touch with the county health director. And we're county health directors are extremely stretched and right now, so we're trying to take as much burden off them that we can, but also coordinate through them so that their office is aware and understanding and directing, and then we're trying to do all the labor behind it in cooperation with all the treatment plant operators that we rely on so heavily.
Awesome. Okay. No, those are all good notes. Thank you, David. That's great. Here's a quick one, and there's plenty more coming in. How many participants are there? We may have talked about this, but maybe to double check on that one.
So 5 counties currently, and we expect to be up to 40 to 50 counties by the end of the month.
Oh, great. That's awesome.
So we're just now scaling it, so it'll grow. It'll take a few months before trend data are robust for the treatment plants just joining. So the robustness of a trend is a factor of how many points we have, and with weekly sampling, that takes a bit of time.
Okay, great. Here's a good one. As a consultant for several treatment plants, how can I get the plant owners to start participating with sampling and reporting? Do you guys have any advice for that?
Yeah, email me directly. This is Dave talking. Sorry, my head's not showing. Love to chat with you, and then and we'll coordinate. So one treatment plant. So our current funding goes through July, and then we'll renew and hopefully expand. And a single treatment plant to carry this through to July, it would cost maybe $7,000. And so if that sounds like a drop in your budget bucket, call me up. If it sounds like a lot, then we'll try to get you as the state expands the funding levels and the CDC expands funding levels.
Fantastic. Thank you. And you know, I'm noticing that it's 10:59. We might stay on a couple extra minutes, although most people have to go to meetings, etc. So if you need to drop off, Avery has posted in the chat the link to where the video for this webinar will be posted, and there's resources at that page as well. And I just want to let folks know that I've posted Dr. Larsen, Dr. Collins, and Dr. Hill's emails, so you can reach out to them. That's posted there in the chat. And I will go on with a couple more questions, but we'll need to wrap it up pretty soon. This one is a little bit, try this one, Mary, David, Dustin. We have a person who wrote in quite early. The Manhattan Solid Waste Advisory Committee has been asking the city and state government not only to measure the virus in wastewater, but also to use the results to make decisions and plan. We got the Manhattan Borough President to write to the mayor and governor, yet New York City DEP won't release results to the public like Boston does. Why would this be?
We're not in a position to explain that.
Okay.
I believe that the New York City treatment plants are part of the CDC program and participating in that program, and those data will be made public. And then for the state program, we are working on pulling the CDC data into our dashboard as well. And so watch this space for New York City to see if that comes online into the state dashboard. From the health side, the State Department of Health, the New York City is considered almost its own jurisdiction in terms of health departments, and by the CDC as well, because it's such a massive city. And so there's a lot of navigation to be made through the different agencies but we're working on that. We're with you. So.
Great. Thanks for tackling that one, Dave. I know that's it's a bit tricky as the program comes online, and a city as big as New York City has to figure out how to engage with the public. Here's another question. Is New York State the only state with this program? Are other states also sampling and reporting and sharing information to see if there's trends in the data?
Yeah, we are not the only state. Ohio is one of the early adopters, Michigan, Missouri as well.
There's a Utah for what? Utah?
Utah. Yeah, and the CDC program is nationwide, and the CDC's grouped the different states into phases, and New York's part of the phase 2 rollout. The phase 1 is kind of the pilot, and then the phase 2 is happening. So I'm not certain on what all states are in the phase 2, but what I would like to see over the next 5 years is to have a national wastewater surveillance network, and every single state has its own. In a lot of ways, New York State's ahead of many others. I think we're moving faster at the policy level around this and the legislative level, and then our implementation will be up to speed, by the end of the month, probably bigger than anybody else's. So very excited for New York State.
Absolutely. So seeing that it's 11:03, that might be a good note to start to wrap up on. I wanted to give Mary, Dustin, and Dave just one more chance. Is there anything else you'd like to leave the audience with? And I'll make a note as well that we have a record of everybody's questions. And so we can share that with the presenters today. And as well, you all have the contact information. So I'd encourage some exchange. This is excellent information and really helpful. Just want to see if there's any last thoughts that Mary or Dustin or Dave would like to share.
Thank you.
Oh, no, thank you. This is terrific. It's really, really good. I'm so glad we've been able to do this today. We'd ask too that folks be sure to answer our webinar survey that will pop up after the webinar. Let us know what you think. And you'll also receive a follow-up email with some resources. Again, the survey link again. We'd love to know what you're thinking about the webinar. And then as Avery shared the link, come back, get more resources and the video. We've got that link posted up in the chat. So we'll look forward to folks continuing to engage. And yeah, Avery, did I get everything? We want to say thanks to the presenters. Anything else? I think we're set. Yeah, thanks everybody. I'll go ahead and wrap it up. And thanks again for joining us. Take care. Have a good day.
Thank you. Thank you.
Yeah, you bet. Thanks.
Thank you.